Hello, I'm Dr. Jeffrey H. Barsick, Associate Professor of Medicine at Northwestern University Feinberg School of Medicine. In this module, we will be reviewing ultrasound techniques for central venous access. Here with me, I have a standard GE ultrasound machine that is VA issued for simulation training. Let's first start with talking about the type of probe that you have connected to the machine. For vascular access, you want to be sure to be using a vascular probe. Vascular probes are higher frequency probes that can't penetrate tissues as deeply but are good for seeing vascular structures that may be more superficial. Please note how the vascular probe actually has a rectangular head, which helps to distinguish it from other probes. Another important concept to understand is directionality. In other words, taking a 3D human and what you're seeing on the screen is in essence a 2D image. You need to know, based on how you're holding the probe, whether you're on the left, on the right, whether you're pointing towards the head or pointing towards the feet. The way that that can be done is noting the notch on the ultrasound probe. The notch corresponds to the GE label side of the ultrasound. So when you're using carotid versus internal jugular imaging, lining up this notch on the patient will tell you which side is right or left. We will actually show you this on a real patient. Focusing on the screen, there's a few things we should notice. First, we want to notice how deep the ultrasound beam is actually penetrating to know where the vessel is located depth-wise from the surface of the skin. There are notches on the screen to indicate how deep the ultrasound is penetrating. Specifically on the GE machine, you will notice that our depth is set right now at 3 centimeters. So from the top of the screen to the bottom of the screen, you are penetrating 3 centimeters into the patient. If 3 centimeters is not adequate for the patient, then we can change this depth. Vascular probes traditionally allow the user to go from anywhere from 2 centimeters in depth to 6 centimeters in depth. Right here on the GE machine is the depth knob. And to change the depth, one just needs to twist this knob. As I twist it to the right, you can see that the depth increases slowly now to 4 centimeters. Twist it a little more, 5, 6 centimeters. If I twist to the left, I can reverse it. And as I twist, I can go as shallow as 2 centimeters. Note that the magnification of the screen increases as the depth is lowered, and it actually shrinks in magnification as the depth is greater. Please be sure that it says depth in the lower right corner of the machine. If it happens to say zoom, make sure that the screen is not frozen by clicking the freeze button to turn it off, and then you can push the button that's actually on the depth knob to remove it from zoom and make this say depth. Now we're going to talk about the gain function on the ultrasound machine. Gain is very important because it allows you to change essentially the contrast of the image you're looking at. Fortunately, modern machines have what's called the auto gain on it, where you can just push a button labeled auto gain that gives you the best contrasted image. On the GE machine, we have both an auto gain and a manual control knob for the gain. The gain knob is right here. As I turn the knob to the right, one can see that the contrast of the image on the screen is actually getting lighter. Whereas as I turn the opposite direction to the left, one can see that the contrast on the image is getting darker. This is more for manual control. However, I recommend just pushing the auto button, which will give you the best image possible. The final concept that we need to discuss is color flow. As you can imagine, we will be looking at arteries and veins with our vascular probe, and sometimes it can be difficult to distinguish the two. The color flow button is right here on the GE machine. When I push this button, what you'll notice is a color screen comes on, red and blue, and you'll see a box. Within this box, you can evaluate the flow of the vessel. Directionality of the probe is what detects the color difference. So, if the blood flow is coming towards the probe, the color will be red of the pulsatility on the screen, And if the blood is going away from the probe, the color will be blue. Therefore, how one orients the probe can distinguish between arterial flow and venous blood flow. To turn the color flow off, all you have to do is push the color button again. Now that my patient is in the Trendelenburg position, I am going to demonstrate how to use the ultrasound device to identify the carotid artery and the internal jugular vein. The patient should turn their head to the opposite side that you're going to enter. Only slightly, however. Too much extension of the head can actually cause the internal jugular and the carotid artery to be right on top of each other, and this makes cannulation much more difficult. Next, I want to identify the actual triangle that's made up of the two sternocleidomastoid heads. There is the sternal head as well as the clavicular head. Right in between those two muscles is fleshy tissue where my carotid artery and my internal jugular vein course. As you recall your anatomy, in most patients, the carotid artery is medial to the internal jugular. I want to be sure that my needle entry point is as close to the tip of this triangle as possible to avoid potential pneumothorax. Certainly, the further down I go on this triangle, the closer my needle tip is to the lung. So what I usually recommend is actually putting the ultrasound right in the middle of that triangle. Positioning of the ultrasound is very important. Notice how the positioning is facing me in the same anatomical alignment of how I'm going to be looking at the neck. So essentially my ultrasound's here, my patient's here, and I'm going to get the same image of the slice I'm taking. You need to be very careful that the ultrasound's not over behind you because you're going to be turning your head and it's not as user-friendly. You want it to be in a comfortable position. Next, I'm going to pay attention to the notch that we discussed before, and my notch corresponds to the GE label on this ultrasound. It will also correspond, the way I'm going to put it on the patient's neck, to the medial side of the patient. And I palpate my triangle, and I place my ultrasound probe right in the center of the triangle. To get the best image, I am going to hit auto gain. Now, as we discussed before, you can note that my depth is 3 centimeters from the top of the probe to the very bottom of the probe. So if we estimate how deep it is to the center of my internal jugular vessel versus my carotid artery, one notes that I'm close to about 1.5 centimeters in depth. This is important for the different techniques of cannulating the vessel that we're going to discuss. If I'm not sure where the carotid artery is in comparison to the vein, I can turn on color flow. And as we discussed, I will just push the color button and we can see flow. I'm going to direct my ultrasound probe so that flow is going away from it. And as can be seen, despite the turbulence, the color of the flow in the vein is mostly blue, indicating that the flow is going away from the probe. On the other hand, if I reverse my directionality, one can see that the carotid now becomes blue in color because the flow is going away again in the carotid now. So now that I've properly identified my vessels, I can turn off my color. And again, we re-demonstrate the internal jugular vein and the carotid artery. You can actually see the pulsatility of the vein compared to the pulsatility of the carotid artery. In most patients, the carotid artery is medial and inferior to the vein. Now, because there is some overlap between our patient's internal jugular and our carotid artery, I may try and slide my probe a little bit to see up and down, both cephalad and caudal, to see if I can separate them more lateral to medial. And of course, in our patient here, that cannot be done, so I'll settle for the middle area. There are essentially 4 different ways we can use the ultrasound to cannulate the vein. First, there are 3 different modes of cannulating the vein using the ultrasound in a cross-sectional view, and in some countries they actually use a longitudinal view. We're going to demonstrate both techniques now. So going back to the middle of my triangle, with my left hand, I'm going to hold the ultrasound device in position. The best way to evaluate the vein is to ensure that you're holding the ultrasound device in a position where your hand is also resting on the patient. That way, you're much less likely to move the ultrasound to the left or right during cannulation. I'll ensure that my vessel is centered in the middle of the screen, and the first technique I'm going to demonstrate is the triangle technique. Using simple geometry, I can measure the distance from the top of the patient's skin to the center of the vessel. Where I am holding the vessel right now, it's approximately 1.5 centimeters, a little bit over, to the center of the vessel. Using geometry, if I take my needle and I go approximately that same distance as depth, 1.5 centimeters from the center of the probe, perpendicular to the probe in this plane, and 45 degrees to the probe in this plane, I can go straight down and hit the vessel right in the center. Another possible technique for performing ultrasound insertion is to actually go straight down, almost right on top of the probe, right on top of the vessel. I would go in, and it would be close to about 1.5 centimeters. I would aspirate blood, and then I would come back with my needle at a slight angle, ensure that I'm still aspirating blood, and I could advance my guide wire at that point. A third and final method to use cross-sectional approach is to actually put the ultrasound device right on top of my needle, and actually as I'm inserting the needle, I will be using my ultrasound device to track the needle tip into the tissue. Finally, what they do in some countries is they'll actually turn on the vein and show a longitudinal view of the vein. And as you can see here on the ultrasound, we now have a longitudinal view of the vein, and we can stick our needle in right at the top and actually follow the needle in as we go. This is a little more difficult of a technique and requires a little bit more experience with the ultrasound device, because the way you tilt your ultrasound probe can really determine whether the needle is in the proper plane. So for beginning users, I don't recommend this approach. In the next module, we will discuss essential hygiene practices and precautions.